After 77, signs your kidneys are weakening. Don't wait until you need dialysis to find out. Did you know that your kidneys can lose up to 70 to 80% of their function before any obvious symptoms appear? That is why chronic kidney disease is often called the silent killer. After the age of 70, kidney function naturally tends to decline as part of the aging process. If you have high blood pressure, diabetes, heart disease, or a history of long-term painkiller use, your risk of kidney damage is even higher. The concerning part is that many people only discover the disease when their kidney function has already significantly dropped. At that stage, treatment becomes much more difficult, and the risk of needing blood filtration or dialysis increases. The good news is that your body usually sends out warning signals very early on. If you recognize them and see a doctor in time, many cases can slow down the decline of kidney function for many years. In today's video, we will explore 7 warning signs that your kidneys might be weakening and what you should do to protect these vital organs. The first sign: frequent urination at night. Many people assume this is just a normal part of getting older. It is true that age can change your urination habits. In men, an enlarged prostate is also a very common cause. However, frequent nighttime urination can also be linked to declining kidney function. When the kidneys can no longer concentrate urine as well as they used to, the body may. Besides kidney disease, this condition can also occur in people with diabetes, heart failure, or those taking diuretics. The important thing is that if the number of times you go at night increases, don't just think to yourself, that is just what happens when you get old. Constantly interrupted sleep not only makes you tired, but also affects your heart health. The second sign: swelling in the ankles, feet, or around the eyes. Have you noticed your rings getting tighter? Do your favorite shoes suddenly feel cramped by the end of the day? Or do you wake up in the morning to find your eyelids puffier than usual? This could be a sign that your body is retaining water. Healthy kidneys help remove excess water and salt. When kidney function declines, water can build up in your tissues. The result is swelling, also known as edema. At first, the swelling might be mild. You might only notice your ankles look a bit swollen in the late afternoon. Later, the swelling may become more obvious and last longer. However, swelling isn't always caused by kidney disease. Heart failure, liver disease, vein issues, or certain medications can also cause it. If you notice swelling appearing suddenly or getting worse, especially if it's accompanied by shortness of breath. The third sign: foamy urine or unusual changes. Many people rarely pay attention to their urine. However, this is one of the most. If you see a lot of large bubbles in your urine that stick around for a long time after you go, this could indicate the presence of protein. Protein in the urine is a common sign of various kidney conditions. Additionally, you should pay attention if your urine is red or pink in color, looks unusually cloudy, has a persistent strange odor, or if the total amount of urine decreases significantly. Of course, urine color can change based on food, medication, or how much water you drink, but if these changes persist or keep coming back, go get checked out. A simple urine test can help detect many problems before the disease progresses further. The fourth sign: persistent fatigue and feeling low on energy. You get enough sleep, yet you feel sluggish all day long. Taking a few steps makes you want to rest. Climbing a few stairs leaves you out of breath. Many people think this is just the result of old age. But if the kidneys aren't working efficiently, waste products and toxins can build up in your blood. This makes you feel tired all the time. Furthermore, the kidneys produce a hormone called. This hormone tells your bone marrow to make red blood cells. When kidney function drops, the production of this hormone can drop too. As a result, your body makes fewer red blood cells. You might become anemic, and that makes the feeling of fatigue even more intense. Many people reach for more coffee or energy drinks to stay alert. But if the cause is in your kidneys, those measures won't fix the problem. If fatigue lasts for weeks without a clear reason, see a doctor to check your kidney function and get the necessary tests. The fifth sign: persistent itchy skin with no clear cause. Do you often feel itchy even though there is no rash? You have changed your soap, you have used moisture, but the itch won't go away. This is a symptom that few people associate with kidney health. In the stages of chronic kidney failure, certain waste products can build up in the body. Along with changes in minerals and electrolytes, this can contribute to persistent skin itching. Many people describe it as itching more at night, scratching until the skin is raw, it affecting their ability to sleep. It is important to remember that itching can also be caused by allergies, liver disease, skin conditions, or many other factors. But if the condition persists, especially alongside swelling, fatigue, don't just treat the symptom while ignoring the underlying cause. The sixth sign: loss of appetite, nausea, or a metallic taste in your mouth. Do you feel like food doesn't taste as good as it used to? Just looking at food makes you feel bloated, or after just a few bites you don't want to eat anymore. Some people even describe having a constant metallic taste in their mouth. Food becomes bland or has an unpleasant smell. When kidney function declines, the waste products in your blood can increase. This can affect your sense of taste and your appetite. If this continues, the patient can easily lose weight, lose muscle mass, and become malnourished. This is particularly concerning for people over 70. Of course, a loss of appetite can be related to many other issues like liver disease, stomach problems, depression, or side effects from medication. But if the symptoms last for several weeks and go along with the other signs mentioned today, talk to your doctor. Finding the cause is always more important than just trying to force yourself to eat more. The seventh sign: high blood pressure, or blood pressure that is getting harder to control. Many people think high blood pressure only hurts the heart and the brain. In reality, the kidneys and blood pressure are very closely linked. When the kidneys are damaged, blood pressure can go up. Conversely, long-term high blood pressure damages the tiny blood vessels in the kidneys. This creates a very dangerous cycle. You might notice your blood pressure is higher even though you are still taking your medication. You have to increase your dose. Your blood pressure fluctuates wildly. You frequently have headaches or dizziness. If your blood pressure suddenly becomes harder to manage than before, don't just focus on it. Your doctor may need to evaluate your kidney function to find the root cause. Controlling your blood pressure well not only prevents strokes and heart attacks, but also helps protect your kidney function for the long haul. Silent habits that harm the kidneys after 70. Many people don't realize that the kidneys can be damaged by very common daily habits. The first mistake is self-medicating with painkillers over a long period. Non-steroidal anti-inflammatory drugs, if used frequently or without a proper prescription, can increase the risk of kidney damage, especially in older adults. The second mistake is not managing diabetes well. High blood sugar over a long time is one of the leading causes of chronic kidney disease. Regular blood sugar checks and sticking to your treatment plan are vital. The third mistake is not controlling blood pressure. Every day that your blood pressure is high, it puts extra pressure on the millions of tiny filtering units in your kidneys. Over time, that filtering. The fourth mistake is eating too much salt. Salt makes the body retain more water. This can cause blood pressure to rise and make the kidneys work much harder. The fifth mistake is not drinking enough water or drinking an amount that is inappropriate for your health condition. Most healthy people need to maintain a proper fluid intake. However, People with heart failure or certain stages of kidney disease may need to limit their fluids based on a doctor's guidance. Therefore, there is no single number that applies to everyone. The final mistake is skipping regular health checkups. Many kidney diseases do not cause obvious symptoms for years. Only through blood and urine tests can a doctor detect early changes. How can you protect your kidneys after 70? The good news is that even though aging is inevitable, you can still play a part in protecting your kidney function. The first thing is to manage your blood pressure and blood sugar well. These are the two most important factors in slowing down the progression of many kidney diseases. Second, maintain a balanced diet. Eat plenty of green vegetables. Choose appropriate fruits. Limit processed foods and high salt intake. If you already have kidney disease, follow the nutritional plan provided by your doctor or a dietitian. Third, maintain a healthy weight and stay active. Walking, light cycling, tai chi, or any exercises that fit your health level are beneficial for your heart and kidneys. Fourth, do not smoke. Smoking damages blood vessels, including the tiny ones inside your kidneys. Fifth, do not self-medicate with drugs or supplements long-term. Always inform your doctor about all the medications and supplements. Finally, get regular health checkups. If you are over 70, especially if you have high blood pressure or diabetes, checking your blood creatinine, eGFR. Summary: the kidneys are among the hardest working, most silent organs in the body. Every day, the kidneys filter hundreds of liters of blood, remove waste. Unfortunately, kidney disease often progresses silently. Many people only find out when their kidney function has significantly declined. Today, we have explored 7 warning signs that your kidneys might be weakening. Frequent urination at night, swelling in the feet, ankles, or around the eyes, foamy urine or unusual changes, persistent fatigue. If you notice one or more of these signs lasting for a while, do not wait until your kidneys are severely failing to see a doctor. Early detection can help slow down the disease for many years and reduce the risk of needing blood filtration or dialysis. Thank you for watching this video until the end. If you found today's content helpful, please share this video with your loved ones and friends, especially those over 60 or 70, so more people. Don't forget to like, subscribe to the channel, and turn on the notification bell to keep joining us in our series on senior health. Note: the content in this video is for information. If you have any unusual symptoms or suffer from chronic conditions like high blood pressure, diabetes, or heart disease, please have regular checkups and follow your doctor's treatment guidelines.